I once had a nursing school test question where the client was literally on fire, and half of my class still got it wrong. Why? Because they relied on the exact NCLEX practice advice that most nursing students get taught. If you're doing the same, you might be wrecking your grades and accidentally sabotaging your ability to think like a nurse. Over the next few minutes, I'm going to break down the 5 big mistakes most nursing students make when it comes to doing NCLEX practice questions and what you should be doing instead. And yeah, I'll tell you the full story about that fiery client test question too. First, let's talk about one of the most common pieces of advice that most nursing students get told when it comes to test questions, especially prioritization test questions. I'm sure you've heard to just use Maslow's, just use ABCs, and you'll get the right answer. And I'm not saying those frameworks are bad. They can absolutely help you when they're used at the right time. But most nursing students start trying to use them on test questions way too soon. In fact, I had a nursing school test question way back when I was in nursing school, like over 16 years ago, that proved how dangerous relying on those kinds of frameworks alone can be. Half my class ended up getting this question wrong. And when we went over the answer in class, they were kicking themselves. The question described a patient who was literally on fire, like clothes burning, the whole deal. Except on a test, this is just written words on a page, not an actual client screaming for help in your face. So the actual test question said something more like, client exits the burning house with smoldering clothes and char marks underneath their nose. And then it goes on to say, what's the priority nursing action? Now, you probably see what you're going to be doing here because I already pointed out what the real problem is. But when studying different types of burns in nursing school, you have to understand that it is drilled into you that char marks under the nose equals airway injury. It's like some sort of secret code. And that's because all the hot air from the fire goes down the airway. It damages and burns the mucous airway, which can lead to inflammation. And that means that the airway could clamp shut at any second. So when half my classmates looked at the answer options, they saw things like provide oxygen, secure the airway, and their brains screamed, ABCs, we always prioritize based on ABCs. And so that's what they chose. But I think you can see the problem here because if they had stopped for a moment to think like an experienced nurse, they probably should have picked stop, drop, and roll as the appropriate priority nursing action to stop the clothes from burning. And of course, that was the correct answer because if you just slapped on oxygen, that's a flammable gas, and we're actually increasing the risk of injury and explosions. Not to mention the fact that their clothes are still smoldering, they're continuing to get more injuries. So am I saying it's bad to use ABCs or Maslow's to help prioritize the answer choices when you're on a test? No, of course not. They have their place, but you can't jump straight to those. If you do, they become gimmicky test-taking strategies that don't really help you learn to think like a nurse. You need to first take the time to think through the scenario, to think like a nurse, because if you jump to these right away, it's like taking a shortcut, and the thing you're shortcutting is your clinical judgment. What's even more ironic is that if they would have even used a different framework to get the answer, aka safety prioritization, they could have still gotten that question correct. But it just goes to show that you have to have a framework to think about, to think like a nurse, to prioritize these frameworks before you can even apply the frameworks to get your prioritization. You have to be able to decide, should I use ABCs or Maslow's or safety before you can come to the answer. So how do you get better at this? How could you start thinking like a nurse instead of just blindly applying rules? Well, that brings me to mistake number 2, which is that if you take your nursing instructor's advice of doing 100 practice questions per day so that you can get better at them, stop. Because blindly doing more and more practice questions isn't going to help you think like a nurse automatically. It's only going to burn you out. I mean, let's just do the math on that. If you're doing 100 practice questions a day, let's say you're only spending 1 minute per practice question, which is not a lot because you got to read it, you got to think through it, you got to go through the answer choices after you've figured out what the question's actually asking you, you got to make your best guess, and then you want to read through the rationales. How much are you really going to learn if you're only spending 60 minutes on all of those steps? It's more like cramming, and it doesn't work. Not only that, but when you do this many questions per day, you're probably also increasing your test anxiety pretty significantly. Of course, I'm not saying you should never do any practice NCLEX problems, but I'm saying you need to do them with a purpose And part of that purpose is you need to focus on quality over quantity. You need to treat each individual practice question like it's its own learning experience, because racing through them to get as many done as possible is not going to help you. Now, I'm going to be getting you started on the exact way I recommend approaching practice questions to my tutoring students. So stick around for number 5, where I'll walk you through that step by step. But this brings me to mistake number 3, which is how many practice questions should you be doing each day in nursing school? Now, generally speaking, less is more, because as you can guess, most nursing students are doing way too many, especially at the beginning of nursing school. Now, listen, I know every student situation is different, however. You have a life out of nursing school, I hope. And if not, talk to me, because we need to get you a life outside of nursing school. You might be juggling kids, a job, a spouse, all of that. And that's why, as a tutor, I never like to give one-size-fit-all solutions. It's the reason why I've always included personalized support inside my Study Like a Nurse tutoring community. Because yes, I tutor for a living. I'm a registered nurse, and I also provide tutoring for nursing students. And when you join my Study Like a Nurse tutoring community, you get to come to weekly group tutoring sessions. You can post questions for me on the forum anytime during the week, and I'll respond. And you can access our library of on-demand training videos that teach you about the Silver Bullet study system, dosage calculations, test anxiety, and more. Or if you prefer one-on-one tutoring, you can always hire me for that too. All the links are in the video description. But if I was going to give you general advice on how many NCLEX practice questions you should be doing per day in nursing school, here's what I would tell you. If you're still in your first semester of nursing school, I wouldn't usually recommend that you do very many at all. No more than 10 questions a day for only 3 days per week. Your focus in your first semester should be learning how to study to set up those good habits that are going to get you thinking like a nurse quickly. And it's also building a solid foundation of nursing knowledge. Then, as you progress through your semesters, you can gradually increase the number of NCLEX practice questions you incorporate into your study routine. Now, that's the advice I give to people who are working with me from the beginning of nursing school, because I know that they're studying right the whole way and they are learning to think like a nurse along the path. If you're jumping in and watching this later on in nursing school, I might have different advice for you. Because anytime you're doing NCLEX practice questions, it's not a sprint, it's a marathon. We're working on developing quality thinking so that we can practice how to think like a nurse. And no matter where you are on this journey, no matter how many NCLEX practice questions you are doing right now, you're only going to have a chance to develop that quality thinking if you're using quality questions too. Which brings me to mistake number 4, because AI tools are becoming so much more popular nowadays. And personally, I love them. I use them every day for lots of things. But if you've ever used AI tools like ChatGPT or one of the many others to just dump your PowerPoint slides or study notes in and then ask it to quiz you, you might be accidentally sabotaging your ability to think like a nurse. And here's why. It's because AI tools like this, they put out what you put in. So if you dump in your study notes, the only questions it's going to ask back of you are things that were exactly in your study notes. Now, this might feel helpful, but if you've ever asked your nursing instructor what's going to be on the next exam, they will 100% tell you you're responsible for everything in the textbook, whether they lectured on it or not. So do you really want to limit yourself to only the things in your study notes that you're practicing thinking about? Because don't be fooled, you're not actually being tested on the nursing content either. That's a whole nother video. What you're being tested on in nursing school is how to think about that content, and that's a transferable skill. But you have to practice transferring it in your study time. So when you only get questions on your exact study notes, it's basically a form of memorization and regurgitation. On top of that, the vast majority of AI tools produce very low quality NCLEX style questions. And these practice questions, that's what I'm talking about when I say they're not going to help you if those are the only kind that you are doing. Because you need questions that are going to mimic the kind that are on NCLEX that are actually challenging your brain to think. And to be fair, this isn't your fault. I think they should teach you at orientation how to write a good NCLEX question, or if not how to write it, at least understand the components of a good NCLEX style question so you can learn to recognize that for yourself. It's a really difficult skill that nursing instructors struggle with as well. So it's not surprising that even more and more nursing instructors have been advising students that come to me for tutoring to just dump their notes and their PowerPoint slides into an AI tool and quiz themselves, because they don't understand how to use the AI either. So here's just one problem with AI-generated NCLEX questions. and that is Bloom's taxonomy. NCLEX uses it, your teachers use it. AI? Not unless you tell it to. So they might be writing your quiz questions at lower levels of Bloom taxonomy, which makes you feel like a rock star when you're getting them all right. But then when you get to test day, you're getting questions at higher levels of Bloom's taxonomy, which are going to be a lot more challenging for you, and you haven't practiced them. You definitely want your practice questions to be at those higher levels of Bloom's taxonomy so that they can mimic your actual nursing exams. Now, AI can write these kinds of questions, but you have to train it. So my next question is, do you have time to train an AI chatbot? Do you want to learn how while you're still in nursing school? I didn't think so. That's actually one of the reasons I trained my own chatbot so that I can create high quality NCLEX style practice questions. And I included this tool in my Study Like a Nurse tutoring community. So that's another resource that's available to members who join my tutoring community. You can get unlimited high level NCLEX style practice questions written at the appropriate level of Bloom's taxonomy. Those kinds of questions absolutely can help you learn to think like a nurse when used properly. And now this brings me to mistake number 5, because even if you have good quality practice questions, even if you're doing an appropriate number for your stage in nursing school, there's still one big mistake you're making that's going to surprise you. And that's when you're doing these practice questions in your study time, stop treating them like they're a test. They're not actually a test when you're using them during your study time. They're a learning opportunity. And yet still, most nursing students use them like a quiz to test what they know. You're not being tested on what you know in your nursing exams. You're being tested on how to think about what you know. So your practice questions should be doing the same thing. But when you sit down and you treat your practice questions like a high stakes situation test, as if looking something up would be cheating, all you're going to do is increase your test anxiety and your busy work. And you're going to have so many lost opportunities to practice thinking like a nurse. And thinking like a nurse is what NCLEX and therefore your nursing exams are really here to test you on. So the next time you're doing an NCLEX practice question and you realize, I don't know this, or I don't know something in this problem that seems important, don't just guess and move on with your life. Look it up, but within parameters, because this is not the time to pretend like you're cramming for a test. This is a time to train your brain how to think. So in order to practice how to thinking, we need to have something to think about. So do a quick Google search, look up something in your textbook, get the information you need, the bare minimum of information you need, and then you have something to think about. And check your perfectionism at the door, because it's not even about getting the question right the first time. As a tutor, I don't care if you get it right this time. This is your study time. I care about if you're getting it right on the test. During practice time, I care about if you're practicing how to think. Because if you're doing that, then eventually the how to think skill becomes second nature, and you're going to do just fine on the test. Now, if you're thinking, Nicole, how do I know what to look up in the first place? Or even worse, how do I avoid going down a 3-hour YouTube rabbit hole because I'm not sure what I'm supposed to know? In the next video, I'll walk you through a simple, repeatable strategy that I use when answering NCLEX style questions. It's called the one question to rule them all. And this one tip will change the way you approach your nursing exams forever. Head on over to the next video and I will meet you there.